Hashimoto's thyroiditis, getting to the true root cause. Hi everyone, I'm Dr. Michael Johnson. I'm a board-certified chiropractic neurologist, and I've been in private practice since 1983. That's 39 years as I'm making this video, and you learn a few things. Plus, I suffered with Hashimoto's. I was diagnosed in 2008. A couple of months ago, I had emergency gallbladder surgery, and that flipped over to Graves' disease. So I know thyroid disorders. And the reason I say true root cause is everybody and their uncle, if you go on YouTube and type in root cause of Hashimoto's, you'll get 100 different searches. But the true root cause, I'll tell you right up front, it's iron dysregulation, and I can promise you no one out there is talking about it. I know about it because I suffered from it myself, and I'll show you. So iron dysregulation, your body in most cases has an iron overload problem. Too much iron stored in your system. Iron is great if it's circulating, but you don't want it stored. So one of the questions I get from patients is, why do I have so much iron in my system? Well, think about it. You've been consuming iron-enriched or iron-fortified food since you were a little kid. Remember that box of cereal that you ate? That's all iron-enriched. Flour is iron-enriched, so it's breads and pastas. Everything is iron-enriched. Anything in a package, any type of packaged food has iron in it. So that's why there's this iron overload. Plus, just from the food you eat, just like broccoli or spinach on the vegetable realm, or fish or seafood or turkey or red meat, full of iron. And you can check very easily if you have an iron overload problem by simply checking your ferritin levels. It's a $29 test. My ferritin was 365, and that means nothing to you until you know the reference is 20 to 50. So my ferritin shouldn't be above 50. I'm up here at 365. I'm happy to say, and I'll share this all with you, that I've gotten it down to 298. We're headed in the right direction. But that is serious. It's called hemochromatosis. Anything above 300. So there are those out there who say, look, you just don't run a ferritin test. You've got to do a magnesium, zinc, and copper panel. You got to do a complete iron panel. Sure, that's $200 to $250. Most people, and like I said, I've been in practice since 1983, they don't want to spend $250 to find out if they have a problem, but they'll spend $29. And it's a very simple blood test, a ferritin test. And you can order it. You don't even have to have your doctor order it. Here, let me give you a list of names of labs, because there's two major labs, LabCorp and Quest, and they have LabCorp on demand. So you can just Google this, order my own lab test near me, or Quest Direct. But there's Request a Test, Any Lab Test Now. I mean, there's an Any Lab Test Now down in Milwaukee. Walk-in Lab, Direct Labs. So you can order this ferritin test yourself. And even if it was $49 instead of $29, you're going to get to the root cause. And let me show you why I say this, because this is really important. Forgive my graphics, but the main symptoms of iron overload include the following: inflammation. Folks, every single chronic condition that I've helped in my 39 years of practice, inflammation has been an issue, a major issue. And you can check for inflammation in the blood work, homocysteine, C-reactive protein, very easily. Numbness, tiredness or fatigue, weakness, weight loss or gain, abdominal pain, high blood sugar levels, hyperpigmentation or bronzing of the skin, loss of sex drive, decrease in the size of testicles in males, reduced or absent menstruation. Does this sound like a chronic condition? Maybe you have some of them with Hashimoto's. Well, look if it continues even further. Let's get this to zoom in. Chronic pain, arthritis, liver disease, cirrhosis or permanent scarring of the liver, enlargement of the liver, diabetes, severe thyroid disorders. I just told you that my Hashimoto's flipped over to Graves in a very severe form of Graves with the trauma from emergency gallbladder surgery. Heart disease, pancreatitis, high cholesterol, cancer, stroke, kidney disease, lung disease. A lot of these conditions can be prevented by addressing an iron overload syndrome. And the reason I say iron dysregulation compared to iron overload is iron dysregulation could be high iron, could be low iron. So that ferritin is less than 20 or it's above 50. Well, let's talk about cholesterol a little bit, because everybody and their uncle is on a statin. I mean, there are physicians who want to put statins in the water, which is absurd. You can lower cholesterol naturally. Let me show you how. Because maybe you or someone you know or love has issues with cholesterol, and statins aren't good. And you need cholesterol, folks, for your brain. You need it to insulate your nerves. You need it to make hormones. So, cholesterol. When iron is high, magnesium is low. When magnesium is low, the enzyme that creates cholesterol, the HMG coenzyme A, goes into overdrive and creates excess cholesterol. So instead of addressing iron overload, my God, that's not going to make physicians any money. It's not going to make Big Pharma any money. What is Lipitor the number one selling medication yet? It's billions of dollars. Let's just address the iron overload. Well, look at what stress does. Stress can cause high iron and low magnesium. Not just emotional stress, but environmental chemicals, heavy metals, a poor diet, lack of sleep, mold and other toxins, EMS, food allergies. We're going to talk about food allergies in a little bit because there are physicians, I shouldn't say physicians, functional medicine practitioners out there who hang their hat on food allergies. Well, let me tell you, if your vitamin A is low, you're going to have autoimmune conditions and you're going to have food allergies. So that's something that most people aren't addressing. They're not looking at serum vitamin A. Let's talk about aging, why you age. Aging is iron oxidation. It's rust. You're rusting on the inside, literally, and it's not good. Aging is iron oxidation due to too much iron in your system inside the mitochondria, which stops the production of ATP. ATP is the energy-carrying molecule inside the cell. That is the cellular event that causes aging. So I have patients who come to me, been through a multitude of other practitioners, and no one's ever looked at this. And some of them, I had one lady, her ferritin level was 1200. And I said, did the functional medicine practitioner tell you to see your physician? Because this is very, very serious. No. Did he say about lowering your ferritin? No. See, folks, I was doing functional medicine before they called it functional medicine. Well, let's look at the blood work that you need, because this is important. Now, keep in mind, and I'm going to go over it with you in great detail, that this is just the magnesium, zinc, copper panel, and the iron panel. We also want to get, and I'll show you why, we also want to get a complete metabolic panel, not a basic metabolic panel, a complete metabolic panel. We want to get a complete lipid panel, a complete thyroid panel. Why? Because the thyroid drives your metabolism. Well, if you have Hashimoto's, you can't just look at TSH and free T4 like a lot of physicians do. I mean, what gets me is I've always handled my Hashimoto's. I'm in the hospital, and I have this emergency gallbladder surgery, which had to be done. I was in severe writhing pain. And they go, oh, you've got Graves. We've got to get you on medication right away. I'm like, no. We're not going on meds, because all they want to do with Graves is destroy your thyroid, kill it off. And in my book, God didn't give me any extra parts, and I'm already losing a part, my gallbladder, which is very important. So, yeah. I wasn't having any of that. They wanted to get me to an endocrinologist. I refused. Flat out refused. Well, it's driving AFib. All right, irregular heartbeat. Okay, then I'll get it handled. Well, here's the blood work needed to really assess the iron overload syndrome. Like I said, just to see if you have it, get a $29 ferritin test. But here we go. This is what you want to look at. You want to look at serum iron, iron saturation, total iron binding capacity, serum ferritin, like I told you, serum transferrin. You want to look at copper. Copper is very important. Ceruloplasm. Ceruloplasm is they say glutathione is a master antioxidant. It's actually ceruloplasm. That's the master antioxidant, and it helps with copper absorption and the bioavailability of copper. The RBC magnesium, plasma zinc. You want to look at hemoglobin. This is very important. If you have too little vitamin A, you're going to be in trouble. Like I said, you're going to have trouble with food allergies, autoimmune conditions, several autoimmune conditions. Your vitamin A level should be 3 times higher than your vitamin D. This comes from a gentleman named Morley Robbins, and we'll talk about him in just a minute and his book. Red blood cells and hematocrit. Just to show you where I was at the first time that I did my iron blood work, here's what I had. My serum iron was 69, which was low. My saturation was 27%, which wasn't bad. My total iron binding capacity was low. Should be 340, was 255. Here's the kicker, folks. My serum ferritin was 365. Now, the second time I ran this test a month later, I've got it down to 298. So it's down 67 points, but still, that is not good. My copper was too high at a 120. Ceruloplasm was a little low. Magnesium was a little high. Zinc was a little low. Hemoglobin definitely low. Here's the kicker. I had the exact opposite. My vitamin D was 3 times higher than my vitamin A. That's the exact opposite of the way it should be. Vitamin A should be 3 times higher than vitamin D. My red blood cells were normal, and my hematocrit was low. So, again, you just don't want to look at things in isolation. You want to have complete blood work. A complete metabolic panel, a complete lipid panel, a complete thyroid panel, especially if you have any thyroid disorders, and a CBC with auto diff. That's a big fancy term meaning complete blood count or complete blood chemistry. And it breaks down the red blood cells and the white blood cells. Very, very, very important. So, oopsie, I'm whacking things here. This is the complete blood work and why. See, the complete metabolic panel looks at your glucose levels. Your glucose levels, extremely important because what you're looking for is your brain and nerves need 2 things to survive. Fuel and activation. Fuel is oxygen and glucose. So you want to look at your blood glucose, but you want to look at your hemoglobin A1C, which is your blood glucose over a 3-month period. That's a better indicator. You want to look at your gut function. You want to look at your adrenal function. Your adrenals are your stress glands. You want to look at your kidney function and your liver function. So let me tell you this story, a true story. I go into the hospital. I have pneumonia with my emergency gallbladder surgery. They gave me Lasix, which is a diuretic. They give me too much Lasix. Puts me into acute failure and acute kidney failure and acute heart failure, congestive heart failure. Now, after all of that, I check the iron indicators that I just showed you, plus complete blood work. I start working on myself, thank God, because I'm probably 70% better. I'm back working in the office. If I was just the average patient, I'd still be home in bed. You want a complete lipid panel, checking your cholesterol, triglycerides. Your cholesterol and HDL ratio shows you the risk of suffering a heart attack. Your HDLs and LDLs. Again, the CBC with auto differential. A complete thyroid panel, folks, not just a TSH and a free T4. And then you want to look at your indicators, your markers for inflammation. And as I mentioned to you, I'm not in good shape. The diuretics crashed me. So right now, my inflammation, my homocysteine level is 20.4. It was 24.4. It should be 6 or 7. Initially, my C-reactive protein was 5.8. I've gotten that down. It should be as close to 0 as possible. I've got it down to 1.2. So I'm working, heading in the right direction. Well, when you get your blood work, it's going to look like this. And it doesn't really mean a lot to you as a patient. So what we do with our patients is we put it in a database. This is my blood work, so I'm showing it to you. All the reds are outside the lab values. All the yellows are outside the functional ranges. So you have functional ranges and lab ranges. Let me give you an example. Your liver. The lab range is 0 to 40. The functional range is 10 to 26. Ideally, 14, 15, 16, 17, right in there. That's the difference. Why wait for a problem and let it get to your liver labs, let's say your ALT or AST, your liver enzyme markers? Why wait until it gets to 45? And then you have a serious problem. It's not worth it. It's not worth it. You need complete testing. Well, let's give credit where credit is due. An excellent book, The Strands of Health. This is by a PhD. Well, I'll get off his name there. Rick Malter. Great book. So along with that blood work, you want HTMA. It's called Hair Tissue Mineral Analysis. That's what it stands for. Rick Malter was the first one to bring this up. Great book. Another great book, and probably someone who's taken it even a step further, Morley Robbins. Cure Your Fatigue. Excellent. He does a great job of explaining the mitochondria, the powerhouses of the cell, but he doesn't talk about how to support them nutritionally with supplements. I think that's important. Morley has a little bit more of a cookie cutter approach. I don't think you can have a cookie cutter approach. I just don't. I'm sorry. That's where him and I kind of diverge. He's not in favor of using zinc or calcium at any time. I think patients may need zinc or calcium depending on the patient, depending on the lab findings. Again, you're just not going to run the magnesium, zinc, and copper panel and the iron panel. You need that complete blood work like I showed you. And why? Because you're looking at all your systems. You're looking at kidney function, liver function, gut function, adrenal function, everything. So, excellent book, but I don't agree with the cookie cutter approach. I don't think that can be done. And look, you're going to help patients with the cookie cutter approach. Don't get me wrong, he has. But when you get some really tough cases, you really need to look at an individual. That's vital. A couple of other people I want to mention. Ray Peat talks about iron overload. I don't necessarily agree with how he handles it. And then I have a very good friend, Dr. Robert Sillig. Dr. Sillig is down in Chicago, Illinois. Personal friend of mine, great guy. I call him the master of minerals. Just really a wonderful person. Now, a couple of questions that I always get. Number one, how do I know if this will work for me? Patients will tell me, Dr. Johnson, I've tried umpteen things. I'm almost sick of trying different things. How do I know this is going to work for me? It's a very simple test. Just run a ferritin test, $29. See where the ferritin is at. Is it above 50 or below 20? You've got some iron overload issues. You've got to get those handled. Otherwise, you're not going to get better. Do you remember the list of symptoms that I gave you? Well, will this work for other conditions? You know, I have multiple issues, not just Hashimoto'S, but I have whatever, lupus, fibromyalgia. Yes, this really gets to the bottom of it. Remember what I said right off the top, inflammation. In every chronic condition, inflammation is the key, and you've got to get that down. And you can measure the inflammation in the blood work, homocysteine and C-reactive protein. So I don't care what your condition is, this has to be addressed, or you're truly not going to get better. I get this, how long and how much? Well, it's not cheap, I'm going to tell you that up front, because the blood work is very expensive. If you went and had this blood work done at a hospital, and we've had people try, it's like $5,000. So we do offer financing. We try to make it as affordable as possible. But we go 12, 18, and 24 months because it takes time to turn this around. This is like turning around a huge ship. It doesn't happen overnight. But the patient will see change as we move along. So 12, 18, and 24 months. The 12-month care plan is $11,995. The 18-month care plan is $14,995. The 24-month program is $19,995. And like I said, we do offer financing. And I can't afford it. I understand that. I get it. I mean, we want to be as thorough as possible. We're doing the blood work. That's what it takes. I mean, we offer the financing. I don't know what else to say. So, you'd like to get in touch with me? If you would like to see if you can qualify to be a patient, let me tell you what I mean by that. I've had COPD patients that I've worked with and helped. But some of these COPD patients, they've promised me that they've quit smoking, and they didn't. They still continue to smoke. Or I've had autoimmune patients drinking a 12-pack of Diet Mountain Dew a day. And they've promised me they've cleaned up their diet, but they haven't. Look, if you're not willing to make a lifestyle change, this isn't for you. Don't do this. I mean, get things worked out, and in many cases, it's emotional. They're eating emotionally. And I understand there are a lot of stressors. But if you're eating emotionally and you're under a lot of stress, this isn't the right program for you. You have to be willing to make a change. You have to be willing to eat a healthy diet and eliminating junk food. I mean, I've had some patients come to me and they are literally living at fast food places. Well, I'm busy, I work, but you've got to change. You have to change. That's all there is to it. So, if you would like to see if you qualify to be a patient, email me. If this is on Facebook or YouTube, don't text me or PM me. The only way to get in touch with me is email, drmlj83@gmail.com. Please share this video with your friends, family, social media. Like and subscribe the video if it's on YouTube. Put it up on Facebook. And again, drmlj83@gmail.com. That's it in a nutshell. That is the true root cause of really correcting Hashimoto's. And I know because I'm living it. So if you're interested, drmlj83@gmail.com. Email is the only way to get in touch with me. I'm Dr. Michael Johnson. Thank you for taking the time to watch this video, and I look forward to helping you in the future.